You know the term, I'm not in the mood tonight. Well, doctors say some women really aren't. It's a condition called hypoactive sexual desire disorder, but clinical trials conducted on a drug show it could make a difference. George Washington University professor Dr. James Simon is working on this project right now, and it really shows some promise, apparently. Tell us about it.
Yeah, Natasha, we tested over 1,000 women who had a low sexual desire. Now, these were young women. These were women who were not menopausal, who had low desire and no apparent reason for it. They weren't depressed, for example. They weren't in a bad relationship, etc.
You usually think about this condition in older women. They're going through changes, hormonal changes in their body.
Right.
But it can encompass a whole group of women.
Right. And this next round of studies that we're trying to recruit for enrolls both the young women and the postmenopausal women. So any woman like 18 to 70 could be in these next round of studies.
Let's back up a second. Let's
Sure.
talk about what exactly this disorder is. Basically, someone doesn't have the desire. They don't feel like having sex. They don't think about it?
Right. They don't think about it. They don't have fantasies. Women have a lot of sexual fantasies as part of their interest in sex. It never comes up. They feel kind of neutral toward the whole idea, and it didn't used to be that way.
Okay, so it's a definite change in the personality or the want, the desire to do that. So what usually changes it? What have you found?
I don't think we know. All kinds of things seem to cause it, but the common thing that we really believe is going on is a change in the chemistry of that woman's brain.
How does a woman know that she has it? Because, you know, you could go a week and say, yeah, it's kind of changed, but I've had a hard workload, the kids are around, and it just hasn't been on my mind. How do you know that, wow, something's wrong?
This is a good question, and it's not just every once in a while. This is frequent and persistent loss of interest in sex. Something changed, a switch went off, and it's not coming back on when you're on vacation or when you have a new lover or for any other reason.
Nothing's changing.
Off.
Many women have talked about they're taking birth control or antidepressants and they feel the lack of sexual desire. Is this something, does it mean that these women have the disorder? Or is it just because of the medicine they're taking?
Well, it wouldn't be from birth control pills, because women who are on birth control pills can be in our studies, and they responded just as well as women who are not on birth control pills.
But do you think women that have reported these symptoms and are currently taking birth control or antidepressants have this disorder, or it's in fact a symptom of the prescription that they're on?
Let's take birth control pills off the table, because it seems unrelated to birth control pills. But antidepressants and depression itself can cause a reduction in a woman's desire. So as it relates to depression, it's a special case. It's a very important case, and it's quite frequent, but it's not what we're really studying here.
Okay.
We know that depressed women frequently are not interested in sex, and women who are treated with antidepressants, even though we think they're not depressed anymore, are frequently not interested in sex. We have other issues that we have to deal with in those women. Those aren't the women we're studying. We're talking about women who aren't on antidepressants, who are not depressed, and for them, desire just went out the window. And this
changes happen. The drug that you're studying, flibanserin, pronounce it for me?
Flibanserin.
Flibanserin. Now, any side effects of this drug?
Well, there are some very minor side effects. The patients who are in the studies found the side effects to be just a little bit of a nuisance. They are drowsiness and dry mouth. And the drowsiness is something that's not a problem because we give the drug now at bedtime. And the dry mouth is something that's usually reasonably transient, so it goes away after a couple of weeks.
Now, in your study, how long did it take? How long did these women have to be on this drug and take it every day until they felt like they used to feel?
About 4 to 6 weeks is when we could document that they really could see a difference in what was going on. So not unlike some of the antidepressants that take a while to kind of kick in. This is not like Viagra, 30 minutes later, you know.
It takes some time.
Right. This takes a little time.
Okay.
It's given every day, but we could definitely see a difference by about 6 weeks.
Why take this drug? Why not? There have been reports of people going to counseling, even couples going to counseling to talk about something's not right here. What's going on? Why are we so quick to just, here's a pill, fix it?
Well, first of all, we're not so quick to fix it with a pill.
Well, I feel that society sometimes is, if you know what I'm talking about. Isn't there a pill in a bottle somewhere I could take to fix me? And I think doctors are quick to say, go to the pharmacy.
There's no question about it. There are some women, some men, some couples that have such a stigma about getting counseling, about their relationship, about their situation, etc., that they really want a pill to fix it. This is not the kind of research we're doing. Couples are encouraged always to see counseling. If there's a problem that we can identify in the relationship, then we go for treatment of that problem. This is for women who are in a good relationship, who, for reasons that we really don't know, have just lost this little piece of themselves, and we're trying to help them get it back.
Before we go, doctor, I want to address men. This happens to men as well. I know your study is not about men, but enlighten us about that. Could there be treatment, similar treatment for men that have lost that desire?
Because the frequency of loss of interest in sex is so much more common in women, we're studying this therapy for women first. But there are plans to look at this same drug for men who have low desire. Now, in men with low desire, sometimes it's just a hormonal thing, and that can be treated with conventional therapy, etc. But we are going to look at this new therapy for men also.
Further to see what happens. You've studied thousands of women. You've done that. You've seen the symptoms, the side effects. What's the next step as far as maybe a timeline to see before this is available to people?
We need your viewers to volunteer if they have this problem, whether they're young women, 18 to 45, or older women, over menopause, past menopause, to help us test this therapy so that we can accelerate its progress toward the market. And I have no doubt that we're going to see this therapy in the next 2 years.
You think 2 years? All right. There it is. Dr. James Simon from GW University. Thank you.